Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. A year ago today, first lockdown announced by President Muhammadu Buhari kicked in earnest in 3 major cities. We review the pandemic fight since then. Vaccination of eligible Nigerians continue as more government officials, traditional ruler in Cross River, Yobe and Taraba states receive jabs. And Brazil's Jair Bolsonaro faces biggest crisis of his presidency with unprecedented resignations and the country's record of its highest daily COVID-19 death toll. The number of recoveries from COVID-19 in Nigeria now stands at 151,532, as the Nigeria Center for Disease Control reports that more patients have been discharged after they tested negative to the virus. According to the NCDC, the discharges today include 977 community recoveries in the FCT and 57 in Imo State, managed in line with the guidelines. Meanwhile, the agency reported 121 new cases of COVID-19 in 24 hours, putting the total figures at over 162,000. Lagos, the epicenter of the disease, confirmed 40 cases, followed by the FCT and Katsina with 15 and 12 cases respectively. Others include Kaduna 11, Imo 8, Kebbi 8, Nasarawa 8 as well. Delta recorded 7 cases, Edo 3, Osun 3, Rivers 3, Ekiti, Jigawa, Kano 1 each. The Public Health Agency also reported 7 additional deaths, including a backlog of data from the Federal Capital Territory. There are currently over 10,000 active cases and over 1.7 million people tested so far. Now, as the Easter celebration approaches, the NCDC is advising Nigerians to continue to observe the COVID-19 protocol to avoid a spike in infections as was experienced during the Christmas holidays. In a tweet, the agency says, "Remember, COVID-19 spreads when people move around. We must all continue to take responsibility in order to limit the transmission of the disease." Meanwhile, more than 600,000 Nigerians have now received the first dose of the COVID-19 vaccine since the vaccination exercise began in the country. This is according to an update by the National Primary Healthcare Development Agency. As of March 30th, it shows that about 638,291 eligible Nigerians have so far been vaccinated within 3 weeks. The federal government of Nigeria hopes to vaccinate 109 million people against the virus over a period of 2 years. Now, 3 federal government health facilities in Edo State are to receive more funds to build their capacity to tackle the coronavirus pandemic. The Minister of State for Budget and National Planning gave the hospitals the assurance at the conclusion of a 2-day tour to inspect how the funds earlier released were expended. Our correspondent Jessica Olugwoshere reports.
The Chief Medical Director of the University of Benin Teaching Hospital, UBTH, Professor Darlington Obaseki, and his management team leads the Minister of State for Budget and National Planning, Mr. Clem Agba, and team members on a tour of some of the facilities for which the intervention fund has been utilized. The molecular laboratory is also visited. Sequencing is also done here.
There's only one center in Nigeria, I think in West Africa, that can do sequencing. Yeah. That's the ACID in Reservoir University. Yeah. So with this, we will be joining them.
The inspection continues for Mr. Agba and his team, with the visits to the Federal Neuropsychiatric Hospital, also in Benin City. Here, another tour takes place. Medical equipment, all said to have been recently procured. At the permanent site of the hospital, also in the state capital, stands this facility, which is to hold 10-bedded isolation center and 20-bedded intensive care unit.
In the next 1 to 3 weeks, we intend to start bringing in the equipment you saw at the other end for installation here. You've already seen that we've done some of the things there, like the X-ray, standard X-ray, digital machine, and all that. So we have all the equipment for a standard molecular lab, intensive care unit, isolation center, and then the appropriate PPEs.
The minister considers the tour of the different facilities satisfactory. The centers are to receive the 50% balance of the funds.
The government is spending about 18 billion in providing 52 molecular labs across the country, and these are in the federal medical centers and the university teaching hospitals. We are also providing about 520 bed ICUs across the country. There are also isolation centers we provided money for, and PPEs. For all of the centers, we would release the balance 50% because the money is available, is escrowed. And like I said this morning, it's specifically for those for which we have seen that work has been done.
With the COVID-19 pandemic revealing the needs in the health sector in the country, this federal government intervention is one of the measures said to have been created to strengthen the capacity of the health infrastructure across the country. Jessica Olugusere, Channels Television News.
Over to Taraba State, the government has condemned the action of some Labour leaders who chased away residents about to take the coronavirus vaccine. The Deputy Governor, Haruna Manu, said this when he took his job of the Oxford AstraZeneca vaccine a week after the governor flagged off the vaccination exercise. According to him, traditional rulers need to create more awareness on the safety of the vaccine.
Some people in the local government areas, just in the name of strike, they prevented this vaccine to be administered to some of the people who are willing to take this vaccine. I think it's quite unfortunate. We are talking about COVID-19. This is a very, very serious issue. And I see no reason why some people will go and then prevent other people from taking the vaccine. People that are so willing to take this vaccine, and some people are chasing them away that they should not take this vaccine. And I want to call upon them, they should desist from doing this, else government will take appropriate action on them.
The Obong of Calabar has asked residents to avail themselves the opportunity to be vaccinated when the time comes, as it is the surest way to fight against the virus. The first-class traditional ruler gave the charge at his palace in Calabar South local government area after receiving his first jab of the Oxford AstraZeneca vaccine in the presence of his Council of Chiefs.
The fight to curb the spread of COVID-19 has remained a challenging one due to some form of misinformation and myths available on the public domain, especially with the introduction of vaccines to help build antibodies against the virus. Many people still doubt the safety and efficacy of the vaccine, hence the need for influential people to lead the campaign on vaccination, an action the Obong of Calabar has obliged to. Speaking after taking his first dose of the AstraZeneca vaccine, the Obong says existing rumors about the vaccine are all false, and it is the responsibility of leaders to set examples for others to follow.
We are too mature to fall below that level of thinking this will happen, and that will happen, that will happen. I think it's our own health. So we always create that example for others to follow, and we will let our people know that nothing happens. It's just to keep us clean and neat, that whatever you're doing, you can be sure that you're safe.
The Obong, who was quick to praise the effort of the Cross River State government in the fight against COVID-19, adds that with the level of awareness and information in the public domain, there is no doubt that the state will record a huge success in its vaccination exercise.
The government has done so much to make sure that people are aware, because I think it is that awareness that have created these few cases that we have. And even though financially we are not that strong to create so many centers for everybody around the local government, but I think that awareness actually made people sit up.
While speaking earlier, the Director General of the Primary Healthcare Development Agency, Dr. Janet Ekpayong, states that Cross River State has hit its target for this phase of vaccination, as strategic leaders and frontline workers made themselves available for vaccination. She explains that the state has so far vaccinated a high number of frontliners, such as health workers, military and paramilitary personnel, and journalists within the first 10 days of the exercise across 18 local government areas.
I will encourage cross-riverians to make themselves available whenever it's your turn to take the vaccine, because this vaccine is totally safe. It will protect you. It will build your immunity against COVID-19 virus. It's not to kill you, rather to help protect you and ensure that even if you come down with COVID, you would have built enough immunity to fight the virus, and of course you will stay alive.
With the height attained by frontliners in the state on vaccination, the state government is appealing to its public to follow suit when the next batch is received.
Well, Nigeria joined other countries to declare a lockdown in the country to stem the spread of the novel coronavirus at the end of March 2020. This began after the president announced restrictions in 2 states and the FCT exempting essential services. Since then, the NCDC reported official cases of the virus had risen from 111 to its present figure of 162,762.
We will ensure.
On Sunday, the 29th of March 2020, in his address to the nation, President Muhammadu Buhari ordered a ban on social and economic activities in the nation's capital, Abuja, the Commercial Nerve Center, Lagos, and Ogun State.
Based on the advice of the Federal Ministry of Health and the NCDC, I am directing the cessation of all movements in Lagos and the FCT for an initial period of 14 days with effect from 11 p.m. on Monday, 30th March 2020. This restriction will also apply to Ogun State due to its close proximity to Lagos and the high traffic between the 2 states. All citizens in these areas are to stay in their homes. We will use this containment period to identify, trace, and isolate all individuals that have come into contact with confirmed cases.
As at Monday, the 30th of March 2020, at 11 p.m., the lockdown was to begin. Things started to take shape the next day when the country implemented a sweeping quarantine for these states in a bid to slow the spread of the new coronavirus in Africa's most populous country. As at the time, the number of confirmed cases of the coronavirus in the country had risen to 111, according to data by the Nigeria Center for Disease Control. This was, however, after almost a month since the index case was recorded. On the same day, 14 new confirmed cases of COVID-19 were recorded. Amongst those infected were 2 senior government officials. The novel coronavirus was first detected in Wuhan, China in December 2019. Today, there are currently more than 128 million cases worldwide, 2.8 reported deaths, while over 72 million people have recovered, according to US-based Johns Hopkins University. With the lockdown in its infancy, streets were deserted as citizens obeyed the directive to stay at home. Interstate movements were also affected, and all businesses and offices within the locations, churches, mosques, markets were fully closed. There were widespread concerns about the impacts the restrictions will have on prices of commodities, but the president announces some palliatives aimed at relieving the economic hardship resulting from the lockdown.
Last 4 weeks, most parts of our country have been under either federal government or state government lockdowns. As I mentioned earlier, these steps were necessary and overall have contributed to slowing down the spread of COVID-19 in our country. However, such lockdowns have also come at a very heavy economic cost.
During the lockdown, a lot of organizations were forced to shut down operations, leading to job losses. School children asked to stay back at home, among other disruptions. In terms of the main reason for the lockdown, which was to manage the spread of the disease, the indices would appear to suggest that the lockdown did help slow the rate of infection, as Nigeria has since recorded about 2,000 deaths, a far cry from figures reported by some other African countries. It's been a year since the enforcement of the lockdown in the country. Questions still being answered include how quickly vaccinations can take place, thus helping the economy recover, welfare for both frontline and other healthcare workers in general. The race to put COVID-19 to rest continues.
Well, 1 year after, do we have the virus under control? We have joining us when we return from the break, the Director of Surveillance and Epidemiology with the NCDC. Join us again. Welcome back. Joining us right now, Mrs. Elsie Ilori, Director of Surveillance and Epidemiology, Nigeria Center for Disease Control. She joins us via Zoom. Thank you for joining us on the program.
Thank you for having me. It's a real pleasure to be here. Thank you.
All right. Tell us, for you, how has it been managing the coronavirus for a year since lockdown?
Oh, well, the COVID pandemic actually has really, triggered a lot of response. It's been the response has been so dynamic globally, and for Nigeria, we have been able to do a lot in terms of coordination, and this coordination has been led by the PTF, the Presidential Task Force. It's been very, very, very dynamic for us, and it has also helped in building the infrastructure, some infrastructure in the country. It has been, we use this as an opportunity to build the infrastructure in the country. We look at infrastructures just like the laboratories. We've had from 3 laboratories that were able to test for COVID. We now have up to 70 laboratories that can test for COVID. In fact, we also have 2 sequencing labs, 2 labs that can do sequencing. That's the Redeemers University and that of the National Reference Laboratory at the NCDC. So we've been able to build structure from the pandemic. We're not saying that we like the pandemic, but it has helped in the health security activity, and making sure that we're able to do a lot of things, a lot more things that we would have done if we had not had the pandemic.
So, Dr. Ilori, looking at it, I mean, what would you say was the major challenge, and what do you see us doing as we move into the future?
Now, one of the major challenges for us was the non-compliance with the non-pharmaceutical interventions. And that's the PTF had done a lot in that area too, using the structure of the Ministry of Information, the risk communication structure, to get across to all those relevant people that will need to get the messages across to the people. They have been able to get across to the traditional rulers, the religious rulers. And so, yes, we have this challenge, but we're also trying to overcome this challenge in terms of having proper coordination and collaboration with so many stakeholders that have gone out there to talk to the people. You are one of the stakeholders that have done that, and this program, I'm sure, is also one of the programs that you have been doing, updating Nigerians on COVID situation in the country and what the people are expected to do. And so we have done a lot in that area, and making sure that people take responsibility in terms of being able to take care of themselves and use take the necessary non-pharmaceutical interventions that have been put in place, wearing of masks, making sure you wash your hands regularly, use this hand sanitizer, avoiding crowded area. And of course, if you're in a crowded area where you cannot avoid, you use your face mask and wear it properly, covering your nose and mouth as it should be. Thank you.
We appreciate your time. Thank you so much, Dr. Elsie Ilori, Director of Surveillance Epidemiology with the NCDC. Thank you for talking to us.
Thank you for having me. It's a real pleasure.
Drug maker Pfizer is saying its research has shown the BioNTech COVID-19 vaccine is 100% effective in children aged 12 to 15 years and gives a strong immune response. Let's take a look at more on this in the Global Updates.
Paving the way for U.S. emergency use authorization, Pfizer and BioNTech say their COVID-19 vaccine is safe and effective and produced robust antibody responses in 12 to 15-year-olds. Pfizer hopes that vaccinations of the group can begin before the next school year. The vaccine is already authorized for use in people starting at age 16. The World Health Organization says Chinese vaccine makers Sinopharm and Sinovac have presented data on their COVID-19 vaccines, indicating levels of efficacy that would be compatible with those required by the WHO.
We have Dr. Mercy Edionwe, internal medicine hospitalist, Texas Hospital in the U.S. She joins us for more on the global situation. Thank you for joining us on the program.
Thank you. Happy to be here.
I want to briefly start your thoughts, since the pandemic started, and what you think about how Nigeria has handled things so far as we mark the anniversary of the lockdown.
Well, thank you so much, like I said, for being here. As you have mentioned, the lockdown was started by the president on March 30th. And when there was a lockdown, that had helped with the decreased amount of cases that Nigeria had seen. There actually has been a case study that has looked into how Nigeria's impact of the lockdown, what it did when it came to the cases. And so towards the end of that lockdown, Nigeria didn't see saw less than 2,000 cases that were rampant in the country of COVID. As the easing of the lockdown, though, there was a surge, if you will, of the number of cases, and it went as high as 12,000 in July. So a lot of factors came into play with that, because of the economic constraints when it came to being in lockdown. A lot of people could not afford to stay locked down forever. There were some people who weren't totally adherent to the guidelines of social distancing, wearing a mask. So that all came to play. But I do say that the president instituting the lockdown early when he did help in the number of cases that could have been.
All right, finally, Dr. Dionwe, in comparison to the U.S., lockdown was early, but still, would you have wished it was much, much earlier, seeing as the U.S. is witnessing a lot more of cases and there is the threat of a fourth wave? Briefly, please.
Yes. I thank you. I would have wished here in the U.S. that there was a lockdown, a nationwide lockdown earlier. The former president, he did kind of give the decision of lockdowns to different states. So each state had their own version of what the lockdown was and whether or not they would go into lockdown. And so when we were seeing those high cases in New York, at that point, I wish there was just a universal lockdown. I feel like it would have prevented a lot of our cases that we experienced.
All right, we appreciate your time. Thank you so much, Dr. Mercy Edionwe, internal medicine hospitalist, Texas Hospital in the United States. Thank you for joining us on the program.
Thank you.
Around the world, although vaccination rates are rising and eligibility is expanding, more contagious variants are spreading and a lot of people are still very vulnerable. Don't forget to protect yourself, continue to take responsibility. Visit our website for more updates, also a better understanding of the pandemic, channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay safe.